Welcome back to the deep dive. Today, we are strapping in for a very specific mission.
We are.
It's one that lives right at the intersection of healthcare accountability, legal strategy, and, well, organizational ethics. Our goal is to give you a shortcut into understanding the framework for institutional punishment in American healthcare.
We're diving deep into the U.S. federal sentencing guidelines, specifically Chapter 8.
Chapter 8, right.
And this is the actual mechanism that dictates how organizations, whether it's a huge hospital system or a small clinic, get penalized when they're convicted of things like Medicare or Medicaid billing fraud.
And this is so important because the final number, it's not arbitrary at all. It's not just based on the dollar amount of the fraud, is it?
Not at all. The penalty is determined by a formula, really. It combines the seriousness of the offense, that's your base fine, and this variable measure called the organization's culpability.
Culpability.
Think of it like a score the government gives you for how blameworthy or how negligent your organization was in letting the whole thing happen.
And this idea of standardizing penalties, that goes way back to the Sentencing Reform Act of 1984, which set up the FSG to bring some consistency. It seems like it's designed to punish the culture, not just the isolated crime.
That's precisely it. So our journey today is all about that measurement. We'll explore the culpability score of this point system that can make fines go way up or way down.
And then the big one.
And then, most critically, we're going to define the 7 foundational elements that prove your compliance program is actually effective. Because that effectiveness is the single most powerful tool you have to mitigate, a massive financial disaster.
Okay, so let's start by looking at this scorecard from, say, a federal prosecutor's point of view. The culpability score starts at a baseline, right? Usually 5 points.
Yep, starts at 5.
And then bad behavior starts adding points. These are the aggravating factors, and they can dramatically increase that fine. What are the key things the government looks for?
So we can outline 4 factors that really spike that score. They signal that the problem is way bigger than just one bad apple. The first, and honestly often the most damaging, is management involvement or willful ignorance.
Okay, walk us through that term, willful ignorance. It sounds a little tricky to prove.
It can be, but the burden of proof is met when you have high-level personnel, we're talking executives, senior administrators, directors, who either participated in, condoned, or just deliberately ignored red flags pointing to the offense.
So you can't just play dumb.
You can't. The guidelines define high-level personnel pretty broadly. It's not just the CEO. An investigator looks for evidence, maybe internal audit reports or employee complaints, that the organization was aware of the fraud and then either suppressed it or just failed to act.
That immediately tells the court that this wasn't an oversight, it was systemic, or at least tolerated at the top, and that's a huge addition to the score.
Oh, absolutely. The points added there can be substantial, often 4 to 5 points right away, which catapults the organization into the highest fine multiplier range.
Wow.
Then the second aggravator is prior history. If an organization has a record of similar violations, say a past settlement with the OIG, and then they do it again, they're viewed much more harshly.
So the argument that we didn't know the rules is just gone the second time around. But how does the court define similar?
That's a great question.
If a hospital settled a minor HIPAA thing 5 years ago, does that count against them on a massive billing fraud case today?
Context is key. A minor isolated HIPAA breach is probably less relevant. But any prior settlement involving the False Claims Act, anti-kickback statute, or other major financial fraud, that's considered highly aggravating. It shows a failure to fix the root cause after you've already been put on notice.
Right. What's the third factor?
The third is violation of an order. This is if the organization was already under some kind of binding order, maybe a corporate integrity agreement, a CIA, or a prior settlement, and they breached it.
You broke a promise to the court.
You broke a formal promise. It's a serious breach of trust. And then, finally, the worst thing you could do once the government starts asking questions.
Obstruction of justice.
That's it. If the company hinders the investigation, tries to cover up misconduct, destroys documents, falsifies records, or, encourages employees to lie, the points just pile on. It shows a profound lack of integrity.
Okay, so that's the scary side of the scorecard, the part that makes the punishment fit the organizational crime. But what if the organization shows it was proactively trying to, do the right thing? The score can be reduced.
Significantly. These are the actions that show the wrongdoing was an anomaly, a failure against company policy, not because of it. And the first mitigator is the most crucial one for prevention. having an effective compliance program in place.
Ah, the holy grail.
It really is.
Mhm.
If you have a robust, audited program at the time of the offense, it suggests the incident was a breach of your controls, not a lack of ethical structure. This can reduce the score by up to 3 points instantly.
That's a huge distinction. It fights that initial assumption of just general negligence.
It absolutely does. But the program's effectiveness is really only proven after an issue is discovered. Which brings us to the next 3 factors, and they're all about your response. Number 2 is prompt self-reporting.
So, finding the problem internally and running to the government before they find it.
Exactly. Reporting it quickly to the OIG or DOJ before they find out on their own.
But let's be real here. If an organization turns itself in, aren't they just handing the DOJ a roadmap for prosecution? What's the real incentive?
And that is the ultimate compliance dilemma, right? But the incentive is powerful. Voluntary self-disclosure is one of the biggest factors that can lead to a non-prosecution agreement or a huge reduction in the fine. You're admitting guilt, yes, but you gain control over the narrative and avoid the much heavier penalties that come with getting caught.
So the government is basically saying, come to us first and we'll reward your honesty.
That's the deal. Third is cooperation with investigators. This just means fully cooperating, providing access to information, documents, assistance. Not dragging your feet. You have to be an open book.
And finally,
Acceptance of responsibility. This means admitting the misconduct and taking immediate remedial action,
like what?
paying restitution, changing internal processes, and, this is important, disciplining the people involved, no matter how senior or profitable they are. Showing you're serious about fixing the breach is a powerful mitigator. It can knock another point or two off the score.
Okay, let's unpack this. We're talking about a point system. But how does this culpability score actually translate into dollars? What's the technical mechanism?
This is where it gets really critical. The score dictates the multiplier applied to that base fine. The FSG starts every organization with a baseline score of 5.
Right.
That score of 5 might correspond to a fine multiplier range between, say, 1.0 and 2.0. But if you quickly self-report, cooperate, and have that program in place, you might reduce your score to 2 or 3. That could drop your multiplier range way down, maybe to 0.4x to 0.8x of the base fine.
Wait, so just adding a few points, let's say 5 points for obstruction, can push you from a range starting at 0.4x all the way up to a range that starts at, what, maybe 2.4x the base? Fine. That's a massive difference.
It's an order of magnitude difference based purely on your internal conduct and your response. I mean, think about the comparison from our sources.
Let's hear it.
Imagine Clinic A and Clinic B. Both defrauded Medicare out of $1 million.
Okay.
Clinic A's leadership knew about it, suppressed audit reports for 2 years, and then tried to shred documents when the subpoena hit.
Oh, boy.
That's high culpability. Their scores may be a 10 or 12. Their fine could be tripled, plus criminal charges for the execs. Total organizational failure.
Right.
Now, Clinic B had a robust compliance program. Their compliance department caught an employee's misconduct in an internal audit. Leadership immediately reported to the OIG within 30 days, paid back the $1 million, and cooperated fully.
A completely different story.
A completely different outcome. Clinic B has all these mitigating factors. They face a much lower penalty, maybe $400,000, and they'll likely get a non-criminal resolution, like a corporate integrity agreement.
So the government is explicitly using the fine structure to incentivize ethical self-policing. That effective compliance program is like preventive medicine.
That's a perfect way to put it. Regulatory bodies like the DOJ and OIG expect this. A strong program doesn't just reduce the score, it influences the enforcement decision itself. It signals a culture of integrity, which is what they want to see.
And this is where it gets really interesting for me. If an effective compliance program is the #1 mitigating factor, what does the government actually define as effective? This isn't just a binder on a shelf, is it?
Absolutely not. And the standards have evolved, especially in 2004 and 2010, to emphasize that compliance has to be a dynamic, integrated part of the business. For some groups, like nursing facilities under the ACA, it's not even optional.
It's a requirement.
It's a requirement. The FSG and OIG define 7 core foundational elements.
Okay, let's break those down. Keeping in mind they always have to be tailored to the organization's size and risk.
Element 1, standards, policies, and procedures. You have to establish written standards of conduct, a comprehensive code of ethics, detailed billing protocols. This is the rule book.
Element 2 is setting up the infrastructure, right? Giving the program actual teeth.
That's program administration or compliance oversight. This requires dedicated, high-level leadership, a compliance officer, and a compliance committee. And crucially, the guidelines demand independence.
What does that mean, independence?
The compliance officer must have a direct, unimpeded line to senior management and the board. This ensures the compliance function can't be buried or controlled by operations or even the general counsel, which could create a conflict of interest.
Third, who are you letting in the door?
Exactly. Due diligence in hiring and delegation. You have to screen employees, physicians, vendors, and in healthcare, this is non-negotiable. You must routinely check the OIG exclusion list.
Why is that list such a compliance tripwire?
Because if you hire an excluded person, even if they're just working in the cafeteria not billing, every single dollar paid to that person through federal programs is subject to immediate recapture under the False Claims Act. It's a perfect way for the government to prove fraud. Intent doesn't even matter.
Wow. The cost of failing to check that list is just astronomical. Okay, element 4 is spreading the word.
Communication, education, and training. Staff at all levels need regular, targeted training on laws like the False Claims Act, anti-kickback rules, HIPAA. And it has to be tailored. What a coder needs is different from what a surgeon needs.
Which leads right into 5. How do you find the problems that are hiding in plain sight?
Monitoring, auditing, and internal reporting. This is the proactive part. You have to conduct ongoing audits of your high-risk areas, like medical necessity, documentation, or coding accuracy, to catch things early. And you have to have confidential reporting systems, like anonymous hotlines.
So people aren't afraid to speak up.
Right. A failure to offer an anonymous channel is a huge red flag for the culture.
Okay, element 6 is about what happens when rules are broken. You need enforcement.
Enforcement and discipline for noncompliance. Standards have to be enforced consistently no matter who it is. We've seen cases where health systems had to fire their most profitable physicians to prove to the government that the program had teeth.
And finally, element 7, the follow-through.
Response and remediation. When you find an issue, you have to investigate promptly, take corrective action, and that's not just repaying the money, it's fixing the root cause, and then meticulously document everything to prevent it from happening again.
That list of 7 is really robust, but I think the biggest challenge is that compliance can't be static, right? It's not a checklist you do once a year. It has to be this living, breathing thing.
Yeah, it has to be.
Which brings us to what a lot of regulators now see as the unofficial 8th element.
And that is the element of ongoing risk assessment. If your program is focused only on the risks you found 5 years ago, it's already obsolete.
Things change so fast.
So fast. New technologies, new payment models, all the new telehealth regulations, cybersecurity threats. I mean, if you look back just a few years, the major risk shifted from simple upcoding to these complex schemes involving remote patient monitoring or kickbacks with tech vendors.
Exactly.
So an effective program does formal, regular risk assessments, usually annually, to identify vulnerabilities and prioritize where to put resources.
So an organization that moves its audit budget to focus on new telehealth codes after a big regulatory change, that's a sign of a healthy, adaptive program.
That's a perfect example. That's demonstrating a risk-based focus. And that adaptation, that improvement, is exactly what regulators are looking for now.
So they want to see you're using those assessments to update policies, refresh training, and focus audits on the highest risk areas.
Yes. That focus is what really separates a program that just checks boxes from one that is genuinely effective at managing and mitigating risk.
This has been incredibly clarifying. I think the core takeaway for me is clear. A robust program is just organizational preventive medicine. It helps you avoid catastrophic financial and reputational damage.
And it fosters a culture of accountability and trust, which translates directly into mitigation when the worst happens.
Regulators see this as just essential.
Absolutely. Demonstrating an effective program isn't just about meeting a requirement anymore. It provides a pathway to survival in a world of really complex federal oversight. It's a competitive advantage because it reduces risk and promotes ethical DNA in the organization.
So if we connect this to the bigger picture, it all comes down to commitment from leadership, right? Or it's all just box checking. We talked about having written policies, that's element 1, versus ensuring those policies translate into genuine ethical actions, into the organizational culture.
So what stands out to you about the difference between a policy that's just written and a policy that's actually lived?
And based on everything we've discussed about the power of that culpability score, what is the single most critical step a leader can take to make sure their program is truly effective and not just some expensive binder that fails the moment it's tested?
Something to mull over as you navigate your own organizational risks.